Namaste. We shall discuss about gynecological cancers today. By gynecological cancers, we mean the cancers which we see in women, that is cancer of the uterus, uterine cervix, ovaries, endometrium and vulva. In that, we shall discuss today about ovarian cancer. Ovarian cancer is one of the dreaded cancers among gynecological cancers, and ovarian cancers we can divide into two types broadly: germ cell tumors of the ovary, which we see in younger individuals, that is in first and second decade of life, and then epithelial ovarian cancers, which we usually see after the third decade. Germ cell tumors of the ovary are very rare. We see in younger girls in first and second decade, and they are usually detected in early stage, and they are not very common, and they are amenable for surgery in majority of the situation. And then once surgery is done, most of them will require chemotherapy after the stage 1, and then majority of them, more than 90% of them, are curable. So it's early age presentation, early stage, and majority of them are in stage 1 and amenable for surgery, and post surgery majority would require chemotherapy, and more than 90% of the patients are cured. This is germ cell tumor ovary. But what we see in the community in the larger proportion is epithelial carcinoma of ovary, which we see after the age of 30 years, that is 4th decade onwards. So epithelial ovarian cancer is not uncommon. It is seen after the age of 30 years, and then it doesn't produce any symptom in the early stage. That's unfortunate about epithelial ovarian cancer. And unfortunately, we do not have any screening test to detect epithelial ovarian cancer in early stages. It is called the silent killer, and the symptoms in early stage are usually very vague, like abdomen discomfort, nausea, loss of appetite, and uneasiness, fatigue, or distension of the abdomen, and it can be very non-specific, and it goes unnoticed in early stages. And even if we do ultrasound, transvaginal ultrasound, or CA-125, which is the blood test which is used in the diagnosis and staging and then follow-up of ovarian cancer patients, it is not useful to detect in early stages, and it is not a good tool for screening. So in asymptomatic individuals, there is no way we can detect ovarian cancer in early stage. And if somebody after the age of 40 years has these vague symptoms, and it should be brought to notice of the physician and thoroughly investigated. And by the time we diagnose ovarian cancer, it's usually in stage 3C or 4 or stage 3A or B. And then usually they will have abdomen distension, masses in the ovary, nodules in the peritoneum, and fluid in the abdomen. And the diagnosis is usually by fluid analysis or biopsy of the tissue. And once it is diagnosed, according to the stage, the treatment is decided. So most of the people are diagnosed in stage 3, and then usually they will require chemotherapy first and then to downstage, and then they should undergo an appropriate surgery, that is called optimal surgery. And then once surgery is done, few more cycles of chemotherapy is given, and then even in advanced stages with the present day treatment, we can hope to see 20 to 30% of them doing well for 5 years or beyond. But if there are any patients who are detected in stage 1 and 2, 70 to 80% of them will do well for more than 5 years or more. So that is about ovarian cancer in brief. So broadly, to summarize, is germ cell tumor ovary we see in younger age group, epithelial ovary we see in older age group. Germ cell tumor ovary we diagnose in early stages, whereas epithelial ovarian cancer we diagnose in advanced stages, and most of the germ cell tumor ovaries which we see in children are curable, whereas in epithelial ovarian cancer most of the cancers are not curative, and at the most we can palliate their symptoms or aim for a better survival if they respond well to treatment and if a good surgery is done. So that's in brief about ovarian cancer.